This solution is used to treat certain types of cancer, such as large B-cell lymphoma, LBCL, and diffuse large B-cell lymphoma, DLBCL. It helps to slow or stop the growth of cancer cells. It is important to follow the dosage and timing recommended by your healthcare provider for the best results. Before starting Glofitamab, make sure to read the medication guide and patient information leaflet provided by your pharmacist. Carry the patient wallet card with you at all times and show it to your healthcare providers. This medication is given by injection into a vein as directed by your doctor, usually over 2 to 4 hours. Your doctor will start this medication at a low dose and gradually increase it to reduce the risk of side effects. You will also be given a single dose of another medication, obinutuzumab, a week before your first, step-up dose, of Glofitamab. Your doctor will monitor you closely and help you manage any side effects during and after the treatment. Your doctor may prescribe other medications to help prevent side effects and infection, so make sure to follow their directions. Use this medication regularly to get the most benefit from it, and remember to mark your calendar with a reminder. If you experience tiredness or muscle/joint pain, it's important to let your doctor know. This medication may cause serious side effects, but your doctor has prescribed it because the benefits outweigh the risks. Be sure to report any serious side effects, such as easy bruising/bleeding or signs of anemia. Additionally, watch out for symptoms of nervous system problems, as well as signs of infection like a persistent sore throat or fever. Tumor lysis syndrome and tumor flare are also possible side effects, so it's important to stay alert for symptoms such as flank pain, muscle spasms, or swollen lymph nodes. While a rash is a common side effect, it's essential to seek medical help if you develop a severe rash or symptoms of a serious allergic reaction. If you experience any other effects, be sure to contact your doctor. When taking Glofitamab-Gxbm 1 mg per milliliter intravenous solution, it's important to be aware that it may cause a serious reaction called cytokine release syndrome, CRS, which could be fatal. That's why this medication is administered in a hospital or clinic, under the close supervision of your doctor. This allows for immediate treatment in case of any serious side effects. If you experience symptoms of CRS, such as high fever, trouble breathing, chills, dizziness/lightheadedness, or fast heartbeat, it's crucial to inform your doctor right away. If you are allergic to Glofitamab or have other allergies, talk to your doctor or pharmacist before using this medication. It's important to discuss any inactive ingredients that may cause allergic reactions or other problems. Before using this medication, be sure to inform your doctor or pharmacist about your medical history, especially if you have had recent infections or kidney problems. Glofitamab may cause dizziness, drowsiness, or affect your thinking and coordination. Avoid alcohol or marijuana, cannabis, as they can worsen these effects. It's important to refrain from driving, using machinery, or doing anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended. If you are using marijuana, cannabis, it's crucial to talk to your doctor about it. This medication may make you more susceptible to infections or exacerbate existing infections. It's important to stay away from anyone who has an infection that may easily spread, such as chickenpox, COVID-19, measles, or flu. If you have been exposed to an infection, consult your doctor for more details. Inform your healthcare professional if you are using Glofitamab before having any immunizations or vaccinations. Avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, discuss this with your doctor. It's important not to become pregnant while using Glofitamab, as it may harm an unborn baby. Your doctor should order a pregnancy test before you start this medication. Be sure to ask about reliable forms of birth control while using this medication and for some time after the last dose. If you become pregnant, consult your doctor right away about the risks and benefits of this medication. It is currently unknown if this drug passes into breast milk. Due to the potential risk to the infant, it is not recommended to breastfeed while using this drug and for some time after the last dose. Before breastfeeding, it's important to consult your doctor. When taking Glofitamab-Gxbm 1 mg per milliliter intravenous solution, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you or someone you know has overdosed on Glofitamab-Gxbm 1 mg per milliliter intravenous solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Alternatively, you can also contact a poison control center for guidance. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center for assistance. When using Glofitamab-Gxbm 1 mg per milliliter intravenous solution, it's important to monitor your health with lab and medical tests, such as complete blood count and kidney function tests. Make sure to keep all your medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Glofitamab-Gxbm 1 mg per milliliter intravenous solution as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to create a new dosing schedule. This medication is typically administered in a medical facility and should not be kept at home. It is used to treat certain types of lymphoma and leukemia. The dosage and timing of the medication will be determined by your healthcare provider based on your specific condition and needs. This medication is given through a vein and the infusion process usually takes several hours. Be sure to follow your healthcare provider's instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.